ABC News medical contributor and emergency physician, Dr. Darien Sutton, joining us to talk about this and a few other COVID-related items. Why don't we start with Dr. Sutton? According to the CDC, more than 100 million Americans have now received their first booster shot, but 91 million people who are eligible have yet to get the additional shot. So based on what we just heard, right, and Dr. Burke saying that everyone needs to get an additional booster shot, maybe not. So, and that there could be risks. What do you think of what she had to say?
Yeah, so I listened to that, and I have to say that the concept of the additional risk is very much theoretical. Right now, we know that the primary series plus that additional third dose provides significant protection. And as you just said, unfortunately, only approximately 50% of those eligible have received a booster. So I do think that there is considerable benefit. Now, beyond that, do we need a fourth, fifth booster? I think that that will depend on the individual risk as well as the prevalence of disease, which we will have to wait and see for the future studies to come out.
So what about people who already had COVID? Should they still get a second booster shot if they're fully vaccinated and boosted? I hear this question all the time.
Yeah, I do too. So patients who come in and say, I've recently had COVID within the last 3 months, I will advise them that it's unlikely to get reinfected close after a recent infection. So that provides some protection. However, that protection can be variable from person to person. So I always advise patients that even if you've gotten COVID-19, that you should still get that primary series and that third dose to consider yourself fully vaccinated.
All right, let's get to the action now on behalf of the White House, trying to make the COVID antiviral pill widely available soon. What kind of impact do you see this having? And is this a good move, and is this going to help?
I think it's a great move. We're referencing Paxlovid, which is that antiviral medication that is supposed to work similar to Tamiflu, where you take it early on, you get the prescription, and it's been found to substantially reduce the risk of severe disease, up to more than 80%. So I do think that it would be helpful to provide this to communities, especially those who may not have access with these federally funded outreach programs where patients can get their prescription and talk to a provider.
All right, and finally, launching these test-to-treat sites that we've been talking about, is it possible that the demand for vaccines will actually dissipate altogether?
I think personally that the demand for vaccines oscillates depending on the prevalence of disease, whether or not there's a new variant, and kind of the communal fear and concern that people have. I've seen it as cases go up, patients start to come in asking for that third dose. It seems to be that people wait to be reminded of the threat before they get that additional dose, which is why I try so hard. It's really important to get that dose before you have to get it in a rush when there might be an active surge.
Also, yesterday the FDA approved this antiviral medication that we talked about, remdesivir, to treat COVID in children younger than 12. But some of these kids in this group under the age of 5 are not even eligible for the vaccine yet. So what's your take?
Remdesivir has become a regular medication in my treatment of patients with COVID-19, specifically for those who are high risk. There was a pretty large landmark trial that showed that remdesivir substantially reduced the risk of hospitalization and death if given early on within the first few days of symptoms. And I hope that it can be helpful and available to children, especially, as you said, if those who are ineligible for vaccines don't have that level of protection. And so I think that this is a great move for providing this, especially to those children who are higher risk.
All right, Darien, great to see you this morning. Thank you so much.
Great to see you too.
All right.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.